Hi, my name is Dustin. I'm a respiratory therapist and a respiratory coach. And I had a question that was asked me recently. My quantiferin TB Gold blood test came back positive, but my chest x ray was completely normal. Did they make a mistake? Do I have tuberculosis? The good news is that a positive TB blood test does not necessarily mean you have active tuberculosis disease. I'm going to walk you through what is tuberculosis, why the blood test can be positive, why your chest x-ray is normal, how TB is spread, signs of active TB, and medical treatment options. I'll use some advice from functional medicine and I'll also use some practical advice as a respiratory therapist and a father. So tuberculosis is an infection caused by a bacterium called Mycobacterium tuberculosis. It most commonly affects the lungs, but it can also affect your lymph nodes, bones, kidneys, brain, spine. Unlike many bacteria, TB grows very slowly, which is one reason treatment takes several months. How does it spread? Airborne. When someone with active pulmonary TB coughs, sneezes, sings, or even talks loudly, tiny droplets containing the bacteria can remain suspended in the air. Someone nearby may breathe these bacteria into the lungs. TB is not usually spread by shaking hands, hugging, sharing food, sharing dishes, any kind of contact. Air particles is usually how it spreads and it grows in the lungs. What is the blood test I'm talking about? Well, quantiferin TB Gold test is an immune system test. It doesn't look for bacteria directly. It's asking, is the immune system ever been recognized tuberculosis? If the immune cells recognize TB proteins, the test becomes positive. This usually means one of two things. You have latent TB infection, which is most common, or you're exposed sometimes in your life, and your immune system successfully surrounded the bacteria and placed them into a dormant state, and the bacteria are sleeping, in other words. You feel well, you have no symptoms, and are not contagious. And plus, you'll have a normal chest x-ray. This is about 5 to 10% of otherwise healthy people with untreated latent TB will develop active TB sometime during their lifetime, the highest risk occurring in the first 2 years. The risk is much higher in people with weakened immune systems. Next, in the blood test, you'll recognize is there's a difference between latent and active TB. Active TB is when the bacteria are actively multiplying. They cause inflammation and lung damage. This is when people become sick and may spread the tuberculosis to others. Why was a chest x-ray taken? Chest x-ray looks for damage caused by active infection. In a latent TB, there is no active lung destruction, so the x-ray is often completely normal. So a patient might have a positive quantiferin, a normal chest x-ray, and no symptoms. That's considered latent. What are the signs of active TB? But before I get to that, in your x-ray, if you're an active TB, you will see actual tuberculous rings in the upper apex of the chest x-ray. Why the upper? Because that's where the rich oxygen is kept. It's upper, that's where you see cavitations, as I call it. You'll see those on your x-rays, so you've got to keep watching those. That's why every year or every so often you get chest x-rays before you go when you work with other patients. What are the signs of an active TB? People with active pulmonary TB often develop coughing, lasting longer than 3 weeks. And occasionally have blood because it's breaking up the alveoli walls and causes scarring. Inflammation, scarring, you're going to cough out blood. You have chest pain because of the increased pressure on your lungs. You have a fever because you're having an immune response. You even have night sweats, which is really hot. You're having trouble regulating your temperature and you're fighting an infection. Unexplained weight loss. Fatigue. Loss of appetite. These symptoms occur, medical evaluation should happen promptly. How is TB tested? they do the quantiferin test or the TB skin test. What will happen in the skin test is that they will do a little prick on your hand of the actual tuberculosis antigens, and it'll see if your body reacts to it. If it swells up, you have been exposed to tuberculosis. And that's best from that point on to, without symptoms and x-ray, to continue your regular daily life. Now, if they find in your x-ray you have active TB as well as all these other tests, so showing spitting up blood, we'll also do another sputum test called an acid-fast bacilli test. They're going to check for the culture of tuberculosis to see if they can find it. This is a molecular testing as well. These determine whether the active infection is present. That's why we need to make sure it's present with these further studies. So first thing you do, you take the test. If you're positive, chest x-ray. If we see something, we'll do a sputum sample as well as check if you have any symptoms, and then we'll go from there. How do we treat latent TB compared to non? Latent TB, your healthcare provider may recommend treatment to reduce the risk of further active disease. Some physician will recommend short rifamycin-based regimens or long courses of isoniazid, depending on the health history, medications, and local guidelines. Your clinician will recommend the best option for you. The goal is to eliminate dormant bacteria before they become active. Now, what if I have an active TB? They're going to start you on a regimen as well. Similar to what they do for latent, they'll do a more long-term for active. We're going to try our best to use the antibiotics to help stop the spread of the tuberculosis. And then we're going to emphasize nutrition, quality protein, and then your immune cells and lung muscles and tissues are all built from proteins. That's why we get to add the proteins. You can get proteins from eggs, chicken, turkey, beef, salmon, sardines, tuna, Greek yogurt, cottage cheese, beans, and lentils if tolerated. Aim for 20 to 30 grams or more with each meal. Eat the rainbow. In other words, when you have your vegetables as well. We need antioxidants to support your body as well. These can be in vegetables like red, purple, green, yellow, orange. All these different colors are very high in antioxidant-rich chlorophyll type material to help you metabolize and boost your immune system. You're going to eat about 5 to 9 servings of fruit as well. These fruits are rich in vitamin C, are the ones you want vitamin C to help you boost your immune system. That'd be oranges, kiwi, strawberries, bell peppers, broccoli, Brussels sprouts. And omega-3s are very good for you to boost your immune system and your antioxidant strength. You can use wild salmon, sardines, herring, mackerel, walnuts, chia seeds, ground flaxseed. Aim for fish 2 to 3 times each week. Feed your gut bacterium with prebiotics, oats, apples, beans, lentils, asparagus, onions, garlic, yogurt with live cultures, kefir, sauerkraut, kimchi. People with active TB are at risk for weight loss and poor nutrition, so maintaining adequate calorie and protein intake is very important. Adding D3, magnesium glycinate, vitamin C, K2, zinc to support your immune system. Avoid taking high doses for long periods unless directed when it comes to zinc. Now, magnesium glycinate I mentioned earlier is very helpful to not just for your lungs, but also for your sleep. So if you're having trouble sleeping as well, that's very helpful. You can also include for energy production your B12 complex or B complex. And then you can add selenium, an essential mineral involved in antioxidant enzymes and immune function. You can find these in food sources like Brazil nuts, tuna, eggs, and turkey. NAC or N-acetylcysteine also helps you produce glutathione, one of the body's primary antioxidants. It may also help thin mucus in certain chronic lung conditions. Talk with your healthcare provider before starting it, especially if you're taking other medications. Next you can take is turmeric or curcumin. This has anti-inflammatory properties and may support overall health. It's best absorbed when taken with black pepper extract or in enhanced formations. Next, you need to make sure you sleep 7 to 9 hours of quality sleep. Get good exercise. Latent TB and otherwise feel well, regular physical activity is generally beneficial. If If you have active TB, follow your healthcare team's guidelines. Stress regulation is really important. Chronic stress can affect your immune function. Helpful practices include prayer, meditation, deep breathing, spending time outside in the woods. What about my family? Well, if you have latent TB, you have no concerns. Active TB, you need to protect yourself. You need to make sure that you're keeping yourself protected and getting treatment and your symptoms are under control. You can wear an N95 mask if you need to be around your family or a respirator. What did we learn today? If you had a TB test and it's positive and your chest X-ray is normal, you have latent TB. That means you need to just continue to support your immune system, continue to visit with your doctor to get medical advice, as well as working on improving your nutrition, your exercise tolerance, and your overall connection and growth in life. Remember, healthy lungs depends more on the medication alone. Avoid smoking and vaping, eat a nutritious diet, stay physical, active, sleep well, manage stress, and work closely with your healthcare team. These daily habits support your immune system and a long-term lung health. It's a pleasure bringing health into your hands. Thank you and God bless. And I'll see you in the next video.